Welcome to our special Medicare webinar. We're thrilled to have you join us today. My name is Brent Hunsberger, and I'm a financial planner and author of the Oregonian's annual guide to Medicare Open Enrollment season, which began last week and runs through December 7th. For those of you new to Medicare or those re-enrolling, we know this is a very important and personal decision for yourself or for your loved ones. Over the next hour, we'll be hearing from a team of Medicare experts who will discuss the basics of Medicare that you should keep in mind as you navigate this time. They'll discuss what to consider when choosing a plan to fit your needs. And they'll also talk about how to go about adding prescription drug coverage, which Medicare actually doesn't provide. We'll be answering your questions after each interview. We'll bring all our panelists back at the end of the program as well. So please submit any questions you have via our Q&A box. Just click Q&A at the bottom of your screen. To ask a question, type your question into the Q&A box and then click send. Also, this program is being recorded. The recording will be emailed to you within the week, so you'll have the opportunity to rewatch and reabsorb all the important information covered today. We're excited to be joined today by some leading experts in the industry. Lisa Lettenmeyer, an insurance broker with Health Source Northwest in Tigard. Jason Hegstad of Regents Blue Cross Blue Shield of Oregon. And Bob Ernest, a volunteer with Multnomah County Senior Health Insurance Benefits Assistance Program. And of course, this event would not be possible without the support of our sponsor, Regents. Jason, tell us a little bit about Regents.
Hi, everyone. I'm Jason Hegstad. I am the Medicare Sales Manager for Regents Blue Cross Blue Shield of Oregon. Regents has been in the Northwest for over 100 years, and we've got about 80 years of experience serving Oregon members. We've been here a long time. So as a regional health plan, we live and work in the local communities we serve. Our customer service representatives, case managers, and operations staff all live, work, and volunteer right here in the local communities. We are a tax-paying nonprofit dedicated to caring for our Oregon members and giving back to the communities we serve. One of the things I want to highlight today is how CMS, the Centers for Medicare and Medicaid Services, has recently given Medicare Advantage plans the ability to add more variety to the extra benefits we offer, above and beyond the original Medicare benefits. For the last couple of years, the rules have been more flexible. We've been able to add or make improvements to benefits like alternative care, nutritious meals delivered after a hospital stay, over-the-counter allowances for things like vitamins and supplements, telemedicine for virtual doctor visits, and more. And then new for 2021, we've added a personal emergency response device for each member who wants one, a virtual companionship benefit, and we've improved our meals benefit to include those who are struggling with chronic conditions. Some of these benefits are designed to assist members in staying safe and independent at home, and this is especially important right now in the time of COVID-19. So later in the webinar, I'd like to highlight some of the extra benefits that Regents Medicare Advantage plans offer as examples of the types of benefits people should be aware of when selecting a plan. Of course, we do still offer the extra benefits that people have come to expect from Medicare Advantage plans like dental, vision, hearing aids, and a robust fitness program through Silver and Fit. I'd like to take a few minutes though to highlight some of the other unique benefits that people might not be aware of. Thank you, Brent.
Take on your retirement with a Medicare plan from the name trusted for more than 70 years. Here for today and whatever comes next. Medicare plans from Regents Blue Cross Blue Shield. Live fearless.
All right, thank you again to everyone at Regents. On October 11th, the Oregonian published its special Medicare guide. The contents are also available on OregonLive.com, and it will be reprinted this Sunday and again on November 15th. In it, we cover some of the new developments that seniors face because of COVID-19. We list benefits and features of the 9 largest Medicare Advantage plans in the Portland area. There's also a guide to Medicare.gov's Plan Finder, a key resource for making cost comparisons. We think this guide is a valuable resource, so be sure to take a look at it. Now let's turn to someone who knows how to help people choose the right insurance plan. Lisa Lettenmayer is an insurance broker with Health Source Northwest in Tigard. Lisa transitioned from a more than 15-year career in accounting to insurance in 2003, and she's owned and operated Health Source Northwest since 2004. Health Source Northwest is an independent insurance agency that helps consumers select, enroll, and review Medicare insurance products that meet their needs. Lisa and her husband, Kim Lettenmayer, run the agency together. In her spare time, she enjoys taking family Disney trips, gardening, and volunteering for the 4-H program. Lisa, thanks for joining us today.
Can everybody hear me okay?
We can hear you.
Great. So my focus is going to be to talk about just the Medicare basics. I think it's always important as consumers are heading into, especially this time of the year, which is our annual election period, that they understand what type of insurance they have, because that dictates what kind of decisions they're going to be making. But understanding those basics is very key. So we'll go on to our first slide. So when we're looking at Medicare, original Medicare, there's 2 main components, Medicare Part A and Medicare Part B. Medicare Part A is listed as hospital because the main thing that it was intended to cover is an inpatient hospital stay. And as we look at Medicare Part A, there's actually 4 types of services that are covered. There's hospitalization, skilled nursing facilities specifically for a rehab after a hospital stay, hospice care, and some home health care services. What's important for the consumers to note, and when they're looking at original Medicare A and B, is that some of these components have costs that they would normally have to pay on their own if they didn't have any other insurances to help them supplement that or cover those costs. As an example, an inpatient hospital stay, whether it was 1 day or all the way up to the initial 60-day stay, will cost the consumer the Part A deductible. And every year the government will change these dollar amounts, but as an example for 2020, the Part A deductible is $1,408. So we refer to those as gaps in coverage. These are just dollar amounts that are left behind by the original program, so the consumer needs to pay. The skilled nursing rehab stay, the gaps on that, days 1 through 20 would be no cost, but if you were there still on day 21 through 100 days is going to be a per day rate. And again, this year, the government has set that at $176 a day. So these, again, are just gaps in coverage the consumer needs to be aware of when they're looking at original Medicare A and B. That skilled nursing stay, again, I'm going to reiterate, is specifically for a rehab stay, which is after an inpatient hospital stay. Normally, it needs to be a 3-day requirement. You're there to rehab. So as you're going through that process, if for some reason in your care you've plateaued or are not moving forward, Medicare may, stop helping to cover that and you'll be on your own because there's no part of the Medicare program that does cover long-term care or convalescent stay. So we'll move on to Medicare Part B. So Medicare Part B on your card, you're going to notice that it says medical. And really, this is where you're going to get the majority of your benefits. You're going to have all of your outpatient services. So going down the list, things that would be covered, of course, would be doctor services. That would be inclusive of your primary care and specialty care. There is very specific pieces of alternative care that are embedded in Medicare, subluxation adjustments for chiropractic. And as of 2020, there is a specific benefit for acupuncture, which is low back pain. But other than that, there is no wellness chiropractic or massage that's built into Medicare, nor is there any other acupuncture services or naturopathic. Then we have outpatient surgical services. So that has really ballooned in the last couple of decades. It's not just for your typical cataract surgeries or simple shoulder repairs. We're now seeing partial joint replacements done and coded as outpatient, along with sometimes even heart procedures like stents or a pacemaker installation. Any diagnostics, outpatient diagnostics, so labs and x-rays, that could also include MRIs, CAT scans, ultrasounds, all of those will tend to fall under Medicare Part B, especially if they're done on an outpatient basis, diabetic testing supplies, and then of course, durable medical equipment. Most of us think of a wheelchair or a walker or a medical bed, but this also would include things such as a oxygen tank or monitoring devices. If you were diabetic, it would be your diabetic monitoring devices, or if you're using a CPAP machine, it's the CPAP machine along with the replacement hoses and masks. Our next category is chemotherapy and Part B drugs. So typically the best way I describe this to my clients is think of a medication that would need to be administered by a healthcare practitioner in a health setting. So these are not things you're going to typically do on your own, such as certain injectables, infusion therapies, and again, a lot of the chemo drugs. So they'll be classified as a Part B drug and covered under your medical coverage. And then as of, I believe it was 2009, Medicare did finally add a list of preventative care services. It is a very specific list, a very specific list of exams and a few screening tests and some vaccines that are covered, and that's been new to Medicare. When we look at Medicare Part B, there are costs the consumer would normally have to pay, again, if they only had Medicare A and B. The first cost is going to be the annual Part B deductible, which currently this year is $198. Once that's been met by the consumer, then the consumer and the federal government are going to share the remainder of the costs on an 80-20 split. So the consumer is paying 20% while the government's paying 80%. What's unique to Medicare A and B that people need to be aware of is that as you look at these gaps in coverage that you're supposed to cover, there is no annual out-of-pocket max. Most of us are accustomed to a health plan that has an annual out-of-pocket maximum so that we know throughout the year between deductibles and copays and coinsurance, the most we would have to pay. Original Medicare A and B does not include this, nor does it include prescription drug coverage. That comes along in a separate component under Medicare Part D. But one thing to point out, when you have Medicare A and B as your primary insurer, that does allow you to seek care at any doctor or facility in the nation that agrees to bill Medicare. You're not working off of a network and you don't need a referral. Basically, it's a fee-for-service system. If you are sick or hurt, you simply seek care at a doctor or facility that agrees to bill Medicare in the entire United States. So certainly your access is very broad. And for people that may travel or snowbird, that could be a positive. We'll go on to the next slide. There are definitely things that are not covered by Medicare, and these are what gets brought up a lot. So Medicare, again, was designed as a fee-for-service platform to handle sick or hurt. It was not in its intention designed for routine services, such as routine vision or hearing, routine dental, again, long-term care or custodial, and most of the alternative care, as I mentioned earlier, is not covered. So when we're looking at original Medicare A and B, and we're deciding which way to go with insurance, we really have two unique options. One is just to continue to stay, we'll go on to the next screen, is to continue to stay with original Medicare A and B. And again, that allows you that flexibility to be seen by any provider or facility in the nation that agrees to bill Medicare, but you've got those gaps in coverage, those portions that you are required to pay. So some people, if they're going with this option, will look into purchasing a Medigap plan, also referred to many times as a Medicare supplement. Now, there are several Medigap plans on the market. One of the most popular plans this year is going to be the Medigap Plan G. And what that will do for the consumer is it acts as a secondary insurance. So Medicare A and B pays first. The remainder of the bills would go to the company you bought your Medigap plan from. Under a Medigap Plan G, as an example, it would cover all of the gaps that I was just discussing, with the exception of the annual Part B deductible, which again this year is just $198. As a third component, you would make a decision if you're going to buy a prescription drug plan, and we would refer to those as a standalone drug plan. Again, this is going to be the one that's going to allow you access across the country with no referrals, no network, as long as the provider is billing Medicare, but it will not come with a lot of those other additional services. And it was really intended as a fee for service. There's no management style to this plan. Our other option that you see on the screen, Medicare Advantage plans, also more formally known as Part C, Medicare Part C, this is very different. When you enroll in a Medicare Advantage plan, you are choosing a primary insurer, whether it be Regents or one of the other carriers in the marketplace. They will, from that point forward, get all of the medical bills that are generated. So if you go to the doctor or a hospital, those bills are no longer going to be sent to Medicare for payment and processing. They will actually go to the insurance carrier. And that carrier is going to be responsible for managing and paying those bills. Now, that carrier is not going to do this for free. They're actually paid by the federal government per enrollee. So for each person who enrolls with that particular carrier, they're going to be paid a monthly set amount to manage and take care of that group of people. They are, of course, required to cover all of the same services that would have been covered under original Medicare A and B. But as Jason pointed out earlier, especially based upon government regulations, these carriers can choose to add in additional services or routine services. And this is where we're going to see more management and a wellness focus. Typically, most Medicare Advantage plans come embedded with prescription drug coverage. So it becomes a Medicare Advantage prescription drug plan. In fact, in our market, up until recently, all of the Medicare Advantage plans that were offered would need to be purchased with prescription drug coverage if that's what you wanted, unless you had another option such as VA services. So when you're looking at a Medicare Advantage plan, there are a few plans on the market that are sold without prescription drug coverage, but it's important to note in most cases, that will mean that you're not able to go over and buy a standalone prescription drug plan. So it's important to understand those features before you make an election. We'll go into the next screen.
Can I ask you a quick question, Lisa?
Yes.
Why is this such an important time of the year for all Medicare beneficiaries?
Yeah, if you want to move to the next slide, we'll kind of look at that. So when we're heading into this annual election period, it's actually a time frame that people can choose to make a decision to either stay or change one of two plans. If they had stayed with original Medicare, whether or not they bought a Medigap plan, but they did in fact buy a standalone drug plan, that drug plan can be reviewed and potentially changed during the time frame of October 15th through December 7th. On the other hand, if they're in a Medicare Advantage plan, they also have an opportunity to review the changes for the following calendar year and decide to either stay with that plan or potentially change to another one. With the drug plans, that is really the only time of the year that we can see that you are able to make a change unless you have a special election period. With the Medicare Advantage plans, you'll notice below, there's a secondary period called the open enrollment period. So we're not really going to market or advertise during our open enrollment period, but for those people who may have not realized that the Medicare Advantage plan that they enrolled in wasn't quite right for them, they do have one more opportunity from January 1st through March 31st to make a decision. So this time of the year, Brent, becomes super important because, again, first of all, you have to be very clear on what you already have, making sure to review your plan. If you want to stay with it or change, you have a finite period, especially on the drug coverage. But also, you might be on a Medigap plan right now with a standalone drug plan. And maybe this is your time that you're thinking, I want to look at a Medicare Advantage plan. And if that's the case, you need to make that decision in election between the dates of October 15th and December 7th. If you're on a Medicare Advantage plan and you want to move to a Medigap plan with a standalone drug plan, this again is also the time frame you would do that. You can also make that election from January through March, but in most cases, it's important for the consumer to know that if they've been on a Medicare Advantage plan for a while, they will most likely face medical underwriting to move to a Medigap plan. So being very clear about the terminologies and what we have and what we're trying to achieve is what all of us in the industry, whether we're an insurance broker like myself or a volunteer like Bob from Sheba, that's what we're looking to do, is help people with these decisions.
We have one question that came in from the audience. Question is, they said, I will be 65 in a few months. Should I enroll in Medicare even if I wish to continue work beyond 65?
So generally speaking, if somebody is approaching age 65 and they're still employed and have a group plan, whether it's their employment offering coverage or maybe they're a spouse of somebody who's got group coverage, typically we don't see an enrollment necessary at that point. The only uh, detail to that is how big is the group. So if you are employed and you have group coverage, as long as the group plan has at least 20 or more enrollees, then your employer group is technically considered primary. And you do not need to enroll in Medicare Part A and B. A lot of my clients will go ahead and enroll in Medicare Part A because there is no monthly premium to do that. However, enrolling in Medicare Part B does trigger a monthly premium that you would need to pay Social Security. Our current year Part B premium standard rate is $144.60. That can go up based upon income history, but currently the standard Part B premium is the $144.60. If your employer has less than 20 employees on the plan, it's important to note that the employer coverage will actually be considered secondary to Medicare A and B. So at that point, it does become necessary to enroll in at least Medicare A and B. You can at that point decide to stay with the employer plan, or you may want to opt out and go with a Medicare insurance program.
Now, unfortunately, there have been quite a number of layoffs recently because of the economic situation we're in. What happens if somebody is offered COBRA and they're 65, or is not offered COBRA and they're past 65? What do you counsel they do?
So we want to be very careful about that. So technically, if you've delayed your Part B enrollment because of group coverage and you are now losing that group plan and you're offered COBRA, you do technically have 8 months to enroll in Medicare Part B without facing a penalty. But unfortunately, in the meantime, COBRA is not considered primary insurance right now. That's been talked about at Congress, but it still has not been enacted. So if you choose to stay on your COBRA plan or enroll with the COBRA plan, technically that is not supposed to be primary. Because you are a Medicare beneficiary, you should have at least Medicare A and B. And then with that enrollment, you could continue on with COBRA, although it's probably going to be very expensive, but COBRA would be acting as the secondary. Or again, you simply enroll in Medicare A and B and then work to figure out what Medicare insurance program might be best for you. Usually, given the cost of most COBRA programs, it's beneficial to move on to a Medicare insurance program.
Yeah, sounds good. Another question just came in, Lisa. What do you mean by medical underwriting if you want to change from a Medicare Advantage plan to a Medigap and standalone drug plan?
Yeah, that's a great question. So one of the things that's really not very well known is the timeframes and the medical underwriting that goes along with Medigap plans. So when somebody is turning age 65 and enrolling in Medicare, they're considered what we call guaranteed issue. They cannot be denied coverage. They are not asked medical questions other than if they're a smoker. So it's a window of time that you can purchase any Medigap plan that's on the market. In addition, if you have delayed your Medicare A and B enrollment because of employer coverage, at the moment where you do in the future enroll in Medicare Part B, you would also have a window of time where you could purchase a Medigap plan at what we call guaranteed status. Usually outside of those timeframes, in most cases, you will go through what we call medical underwriting, which is the carrier can ask a series of questions, medical questions right there on the application. In most cases, if you were to answer yes to any of those questions, that could be a declined app right there. If you make it past those medical questions with no answers and we submit the application, the carrier does have the opportunity to look at your medical records and your medications and decide if they want to accept you or not. So being aware of the timing and the ability of this guaranteed issue at age 65, or again, if you've delayed your Part B enrollment, is important. So if we've been on a Medicare Advantage plan, especially for several years, and we're making a decision to enroll in a Medigap plan, we want to be aware that in a lot of cases, we'll have to go through medical underwriting. It's not a guarantee. Now that can come up. Let's say you're on a Medicare Advantage plan. We saw this happen last year in the Portland market. We had a Medicare Advantage plan that was leaving the marketplace. At least that plan was. So that created an opportunity, a special enrollment opportunity for those beneficiaries where they could either choose another Medicare Advantage plan, or at that point, because they were losing their Medicare Advantage plan, they could enroll in a Medigap plan, guaranteed issue. So there are some unique opportunities that will come up, but you just really want to be aware of what those are and how much time you have around them.
Got it. Okay, and one more question from the audience. And I apologize that my mic keeps dropping off. I'll do the best I can to stay close to it. This question says, I'm over 65, still working and have employee health coverage, but will retire at some point, obviously. When I set a retirement date and pick a plan, how much time should I allow between choosing a plan and a retirement date?
That's a great question. I usually advise our clients to give yourself a 3-month window. And the reason for that is there's a little bit of an extra timing step involved in that enrollment in Medicare Part B. Because you didn't enroll at age 65, we do need to prove to Social Security that you have been covered under an employer group plan since turning age 65. And that's done through a form, the employer verification form. It's a 2-page form. The first page is going to be completed by your employer or HR department. And it's going to basically just attest that you have been covered since age 65 and that you will continue to be covered until a specific ending date or that you're still actively covered. The other page you fill out and you just simply write in when you want your Medicare Part B to start. Please note that it always is a first of the month effective date. So with those 2 forms completed, you would then either walk them into Social Security if we were not under a pandemic, or you typically right now will mail them to Social Security. In our experience, it usually takes Social Security about 3 to 4 weeks to process that and notify you that you've been approved and you're enrolled in Medicare Part B. In the meantime, you can be working with going to seminars, doing your own research, working with an insurance broker or a volunteer to find out what is the best program that's going to meet your needs with your doctors and your prescriptions, so that once that approval comes in, you're ready to go to get that effective date. The paperwork part of the insurance is very easy. It takes us very little time to do the insurance piece. It's just making sure you have Medicare A and B active.
Yeah. Okay, and another quick question, just a clarification. Are premiums $144 a month or a year?
So for Medicare Part B premiums, which is paid to Social Security, currently for 2020, the standard premium is $144.60 per month. If you're receiving Social Security income benefits, it's going to come out of your income benefits before they pay you. If you're not, many people are deferring Social Security income benefits, then you will get a paper bill from Social Security. So when you're looking at Medicare A and B, Medicare Part A has no monthly premium, but Medicare Part B does. And then on top of that would potentially be the insurance premiums for what you're going with, whether it's a Medigap plan with a prescription drug plan, or are you going with a Medicare Advantage plan, and what is that premium? In either case, please know you need to be enrolled in both Medicare A and B.
All right, thanks so much, Lisa. Well, you can tell she's been doing this for a long time, can't you? Hang on, Lisa, by the way, we may have some more questions at the end. I'll do my best to get to the questions that have come in that I haven't had a chance to ask yet. As we know, Medicare is not a one-size-fits-all program. So I'd like to invite Jason back to help shed some light on how to choose the right plan for your needs. Jason is the Medicare sales manager for Regions Blue Cross Blue Shield of Oregon. He's been in the Medicare insurance field for 11 years and recently joined the Regions team. A native of the Pacific Northwest, Jason lives with his wife and children in Dundee, where they take advantage of the great outdoors and the slower pace of their rural setting. Jason enjoys spending time with his family, completing projects on their property, and likes to attend an occasional poker game with friends. Welcome, Jason.
Thank you, Brent. Thanks for having me.
Yeah. I think after Lisa's presentation, the question on everyone's mind probably is, how does one decide between basic Medicare, Medicare Advantage, and Medigap? Are there guidelines or questions that you can help us ask to point us in the right direction?
Yeah, I think one of the things that Lisa mentioned already is, the provider choice. Medicare Advantage plans are designed with a network around them, where original Medicare, along with a Medigap plan, is not limited to any particular network. The nice thing about Medicare Advantage plans is they do help coordinate the care a little bit better. So it kind of depends on somewhat how the customer, how independent they are in selecting their own doctors and choosing their own plan. There are also differences between PPO plans and HMO plans. So does someone like a particular hospital network and wants to stay within that network, or do they want more flexibility? Again, Lisa mentioned snowbirds. So if someone lives in Oregon for 9 months out of the year, they go to Arizona for 3 months out of the year, but they still want to be able to see providers down there. They want to make sure that they're choosing a plan that will cover all the doctors that they want to see. On the other side, she mentioned drug coverage. So Medicare Advantage with a drug plan included is one option, or a Medigap plan, Medicare supplement plan, might cost a little bit more monthly, but it is typically a higher amount of coverage when it comes to the percentage of the bill that's covered. So where a Medicare Advantage plan would have copays, the Plan G that she mentioned might not have any copays. The beneficiary would just be responsible for that monthly Part B premium in addition to the plan premiums. So now the Part D plan, if someone picks up a standalone Part D plan, that would have copays and so forth as well.
And just to be clear for everybody, Plan G is a Medigap plan, correct? Is a type of Medigap plan.
That's right. Medigap plans, what we call Medicare supplements, are represented by letters, not to be confused with the parts of Medicare, because there's a Plan A under Medigap, and there's also a Part A of Medicare. And sometimes that can get real tricky because they're both, but you're right. The Medigap plans are labeled by letters. So the carriers that are selling those plans are all selling the same level of coverage for that same letter of plan.
Got it. And the different letters of plans provide different levels of coverage, correct? That's
right. So currently, for folks that are new to Medicare this year and beyond, Plan G is that highest level of coverage available on Medigap. So they will have a small deductible for the year, but overall, most of the medical benefits are covered. The real difference, though, is Medigap plans don't cover extra things, or not many extra things. They can add riders to add something like a fitness membership or dental or vision, but they're not really robust like a Medicare Advantage plan that offers a lot of extra benefits. So someone can maybe buy up and get a dental, vision, hearing package or something like that on a Medigap plan. But really, they're designed to cover the medical benefits.
Got it. Well, what other benefits come with a Medicare Advantage plan then?
So that if we'll go to the next slide, that's some of the things that I wanted to talk about today is some of the extra things that Medicare Advantage plans can include. So things like dental, routine vision, like routine vision exams and eyewear. Original Medicare will cover medical dental, like if somebody has a broken jaw or an infection, but it wasn't really designed to cover the routine services. So things like a dental exam, fillings, those kind of things would be additional to Medicare. Routine vision exams, eyewear allowance, frames, lenses, and so forth. Someone with VA coverage might have coverage for glasses, or someone under Medicare would have a pair of glasses covered after cataract surgery, but they don't necessarily have coverage for routine vision. Hearing exams, hearing aids. So Medicare covers a medical hearing exam for something like tinnitus or a medical condition, but not necessarily just hearing loss due to aging. And then, as Lisa already mentioned, prescription drug coverage. Original Medicare does not cover a drug plan. They do cover drugs that might be administered by a physician in that office setting, but they don't cover prescriptions that someone would pick up at the local pharmacy and take themselves. So the nice thing with Regence plans, we cover dental, vision, and hearing on all of our plans, and that's embedded into the coverage. And then for the drug coverage, we do have copays as low as $0 for those low-cost generics. We do want to highlight the pharmacy network. So one example of how people can manage their care, the plans all have preferred pharmacy chains that they work with. So folks can pick up their prescriptions at Costco or Fred Meyer, and they can get a 90-day supply or even a 100-day supply and get that by mail order or at the local pharmacy, depending on how they choose to pick up their prescriptions.
Now, can you tell real quick, why are you emphasizing the network here? Why is that important?
Well, what's important is that the health plan, along with the pharmacy and Medicare kind of all have contracts working together to negotiate prices. So where we might negotiate a particular price on a particular drug with Costco, that's going to be a different price at Fred Meyer or Safeway or Albertsons. It just kind of depends on what the contracted rates are. It's not a standard price for anything. So it's kind of a three-way contract between CMS, Medicare, and the pharmacy and the health insurance company. So the thing about the drug plans is they all have a formulary list, a list of covered drugs, and they're not all the same. And the copays and the tiers will be different from plan to plan. So when people are comparing a Medicare Advantage plan, they've got to look at not only are my doctors covered, but how are my drugs covered? And that can change from year to year as well. So this is the time of year when people are making that comparison. Is my insulin still covered, and is it still covered the same way? Or my heart, blood pressure medication. There's different things that people have to take on a regular basis that, if it changes, it can change their health care. So, they're definitely wanting to make sure that if they choose a new plan, that their drugs and their doctors are still covered, and how are they covered? So the preferred pharmacies give them the lowest cost copays during that initial coverage for prescriptions.
Got it. What other extra benefits are out there? I see. I know.
Yeah, let's go to the next slide. There are some things that have kind of become new in the market. One thing with Silver and Fit, we've had a fitness benefit for a long time, and most carriers now do have a version of a health membership at fitness centers. One thing that this COVID time has done is caused things to be a little bit more virtual. So people are working out from home more often. They're using their fitness kits versus going to the gym all the time. So things that Silver and Fit has added this year, they've added the device, a Fitbit or Garmin tracking device to kind of help with their steps and their biometrics. They've also added health coaching virtually. So folks can get a weekly health coach virtually, through webinar that wasn't there before. And then also a lot more exercise classes online. So someone can go and view a class and be part of a class from home by logging into the Facebook Live classes. So these are things that didn't exist a year ago. People were able to get home fitness kits instead of going to the gym, but it was more just a DVD that you can watch at home and maybe do chair aerobics or something like that. So Silver and Fit has added to the menu because of the time we're in.
Got it. And then you mentioned home support services too?
Yeah, so there's a lot of benefits that are designed kind of around, again, the time we're in. One of the things that we rolled out a year ago was meal delivery for folks that have just experienced a hospital stay or stay in skilled nursing. So when they get home, this is kind of good for the patient and for the caregiver, right? So, you've got a wife that had a surgery, she gets home, the husband isn't used to preparing the meals, but the meal delivery service is fresh frozen meals delivered to their home. So they've got a variety of meals for some weeks in order to kind of get better. Something we've added this year is meal support for folks that have certain chronic conditions. So if someone is dealing with diabetes or is pre-diabetic and going into having a hard time managing, then these meals can help them kind of stay on track or get back on track. And then virtual support is another big thing right now. We are introducing for next year, a virtual companion benefit. So for folks that are feeling social isolation, maybe they also have a chronic condition, they have somebody to talk to. And these, I guess a way to explain it is you've got kids that are college age that have done a lot of training and been vetted, but they're basically a companion for these folks that they can help them with their grocery shopping or prescription drawer drops. They can help them figure out their technology if they need help figuring out their iPad or other technology. They can play games with them, virtual games online. And these members have the benefit of having basically an extended family member that's always available. And they get to work with the same person every time. So that's a new idea, but kind of sparked out of this time that we're in where not everybody's feeling socially isolated, but it's definitely a sign of the times.
And then what other new offerings are there out there in the market right now?
Well, some of the things that people are looking at, and one of the things that Regence is really strong on is palliative care. And this is care that is not just for the patient, but it's kind of the wraparound care that includes the family as well. So they care for the family, the caregiver. So this is something that Regents has taken a real, a good approach to early on, to making sure that someone dealing with, illness or injury has that kind of wraparound care. There are a lot of programs at Regents, like diabetes prevention or other chronic condition support, where case managers kind of help coordinate that care a little bit better by being more proactive and helping guide someone through the process. We do have the 24/7 nurse line where people can call and ask health related questions. But one of the other things that's really taken off this year, especially since February, March, is telehealth. With all of the facilities, not really wanting people to come in and get each other sick, virtual doctor appointment has become the new normal. So a lot of the Medicare Advantage plans have telehealth as a vendor to benefit, but also CMS Medicare has made it easier for every doctor to do virtual appointments and still get paid for them. So that's one of the things this year that Congress has really stepped up on, is making the decision to kind of fund those extra virtual appointments without a copay. So
you have a slide. I'm sorry to interrupt you. I want to get to some questions here in just a second.
Yeah.
But you have a slide about extra coverage during this COVID-19 era. Can you talk a little bit about that?
Yeah, I just wanted to make sure that people know that the carriers are really paying attention and have taken an extra step for the folks that are dealing with the COVID-19 crisis. So in addition to free testing to make if a doctor thinks that you need a test, you get a test and there's no copay for that. They've also stepped up and done, or Regents anyway, has all of the COVID-related symptoms and treatment for no cost as well. Currently, that's through December of 2020. I understand the other day that they've extended the emergency declaration through January 21st, I believe. So another 90 days. So we'll see how this evolves as we go forward. But obviously, in March, none of us thought we'd be still in the position we're in today. So,
Right.
A lot of us are working from home, and people are staying home and not seeing people, and whether that's getting better in January or June or who really knows at this point, right? So,
Right.
but at least initially we extended it through the year, and then
Go ahead.
Oh, sorry, go ahead.
Oh, I just wanted to ask a couple of questions from the audience. One is from Joan Snyder. She asked, if she bought a Regents Advantage plan, can she see a Blue Cross Blue Shield provider out of state? For example, if she needs services when visiting a daughter in Florida.
Thank you. Yes. Because we are, well, I should say, with a PPO plan, we have a network sharing agreement across 43 states in 2021. So whether it's Florida or Arizona or Vermont, there's 43 different states where you can see in-network providers on the Regents Oregon plan, because we have a network sharing agreement with all the other Blue Cross Blue Shield plans nationwide in 43 states and Puerto Rico. So if someone were to go to bcbs.com, find a provider, they could look at all the providers in all the states.
Yeah. Here's another quick question. Can you choose your own dentist?
Yes. One nice thing is we actually contract directly with the dentists. So some companies will kind of buy a network where you're getting a network that's already kind of developed. Regents directly contracts with dentists. So if you want to choose a dentist, and again, there's the difference between HMO and PPO, right? So if someone's on an HMO, they choose a dentist from within the network. On a PPO, they can choose a dentist from within the network, or they can choose a dentist outside the network. However, they're going to end up paying more for services outside the network.
Okay. One other question that was sent in ahead of time is from April Ober. She asks, Kaiser is rated 5 stars by Medicare. Regents is rated 4.5. Is it an overall rating, or is Regents lacking in what area, and what is Regents doing to obtain that rating?
So Medicare released the star ratings, and usually that happens in early October for the following year. And Regents is rated 4.5 stars out of 5. Kaiser actually is the only plan in Oregon that reached a 5-star rating, so that's excellent. But the plan star ratings go from 1 to 5 stars, 1 being poor, 5 being excellent, and 4.5 stars is really, really good. So there are many different measures. There's about 50 different measures that CMS is looking at from, quality improvement, health outcomes. It could be customer service. They also do a couple of surveys each year and survey members on how the experience with their most recent doctor visit or how their experience is with the plans. So there's a lot of different things, a lot of moving parts on the stars. The thing with Medicare stars is it's a moving target, and every year the weights for the different measures change a little bit. So it's something where we really have to stay on our toes, and we've done a really good job. 4.5 stars. There's only a couple of other carriers that are that high in Oregon.
All right. Thanks so much, Jason. I appreciate your in-depth explanation of all the benefits that a plan can offer. Somebody asked if all plans offer benefits that Regents plans do, and it really varies. They can, some plans offer a lot of extra benefits and others don't, but
that's right.
It's important to just shop carefully.
Thank you.
Thank you, Jason. I want to move on to our next guest. Medicare has a program called Medicare Part D. We've referenced it several times. It's a plan to help pay for your prescription drugs. So I'm going to have Bob Ernest, a longtime volunteer with Multnomah County SHEBA, or the Senior Health Insurance Benefits Assistance Program, explain that Part D program and things to consider when choosing a plan. Bob is a Portland State graduate. He worked in human services for 30 years. He began volunteering for SHEBA in 2004 and has done that pretty much ever since, helping seniors navigate the complexities of Medicare. Welcome, Bob.
Thank you. Thank you, Brent. Glad to be here.
So tell us a little bit more about Medicare Part D and why somebody might want to have that as coverage.
First of all, Lisa and Jason gave a really good introduction to Part D. Part D it began in January of 2006. Going back a little bit of history, it was actually passed in October of 2003 and implemented effective 1/1/2006. And it was the first time that Medicare has had outpatient prescription drug coverage. Many of the Medicare Advantage plans include it at little or no additional cost. And then there are also the standalone options available to people. It's fairly easy to access. They want the program to be utilized, and so Medicare only requires that you have Part A in order to participate in B, or in D, excuse me, as in drug. But most people have A and B, but there are those exceptions that only have Part A. But you can get into Part D with A and B.
Got it. And I think Lisa mentioned that there were Part D was included on some Medicare Advantage plans, right?
Correct. In fact, the majority.
Got it. But then you can also purchase them standalone if you have a Medigap plan or basic Medicare.
Correct. But you can't have a Medicare Advantage plan and a standalone drug plan at the same time, currently in the state of Oregon.
Okay, I wonder why that is.
Basically, if the Medicare Advantage plan offers drug coverage, you take their drug coverage, and it's typically very good coverage.
Yeah, got it. Now, I've heard about extra help coverage. What is that, and how do you qualify?
Okay, the slide here has the maximum incomes for a single person, maximum incomes for a married couple. And on the resource limit side, that again, maximum numbers. The extra help program will help reduce your premium for Part D, in many cases to zero. If you have a Medicare Advantage plan, they will take a certain amount of dollars off of your monthly premium, if there is a premium for your Medicare Advantage plan, but it helps reduce the monthly cost for the premium. More importantly, it gives you a much lower cost on your medications. You can actually get this next year if you're eligible for extra help, generic medications should come in at $3.70 for 1 month supply, and brand names at $9.20 per month. There's no coverage gap. You have coverage all the way through. It's pretty straightforward. It's worth several $1,000s to eligible people, and we encourage people to apply for that. And I think on the slide, there was a phone number. I don't see it here.
Oh, it's on the next slide.
Oh, it's on the next, I'm sorry, okay. Okay, this phone number is to the Medicare Savings Connect. It's actually a program run through Multnomah County and it's statewide. Call that number between 9 a.m. and 5 p.m. Monday through Friday. A live answer will answer your questions and do an initial screening and make the appropriate referral to wherever you need to go, whether it be to a county office for additional services or take the application for extra help and submit it for you online. But it's a really valuable program. Can't say enough good things about it.
I've got two questions that have come in that I want you to answer, Bob. One
Sure.
is, does the Oregon Prescription Drug Program qualify as Part D coverage?
I happened to read that before I came on. No, it does not. It's in addition to, you can, and what happens sometimes, not often, but sometimes the OPDP program will actually give you a better pricing than will your drug plan. So it does happen, but no, the Oregon Prescription Drug Program does not take the place of Part D. You still need Part D if you're going to participate. And that's something else. This is a voluntary program. And if you don't participate when you're initially eligible, then you could be facing late enrollment penalties, which unfortunately could last the rest of your life under current operating procedures.
Yeah, that leads me to another question from another listener. She said, if I don't choose a drug plan now because I don't take any medications and add a drug plan some years from now, will it be more expensive?
The quick answer, yes. As a volunteer, in situations like that, we would at least point out, you may want to consider getting a zero premium Medicare Advantage plan, because typically they also include drug coverage, and that way you're covering all your bases at no additional cost. For 2021, the standalone drug plans, the lowest cost one is going to be $6.30 a month, and the most expensive is $124.50. So there's a huge range among all of the options that are available to people.
So what's the best way to go about choosing a prescription drug plan, Bob?
Probably the most important thing is to make sure that your medications are listed. I would urge you to go to the Medicare Plan Finder, there's a slide there. Brent had this in the Medicare guide that was published in the Oregonian. Excellent, excellent. 1, 2, 3. Follow it through. It's fairly easy to use, I believe, and you can run your medications on there, look at your pharmacies. You can toggle back and forth for some different options to see if you want to do lowest cost plans without deductibles, etc. So there's some filters to be used on there.
I also wanted to mention that viewers can also contact Oregon Sheba
Yes.
and its network of statewide volunteers with
Right.
questions about your Medicare coverage and also with help selecting a plan, correct?
Correct. That phone number it's in Salem. By dialing the 800 number, it'll prompt you to enter your zip code. And if you have a zip code with a live answer or a county component, they'll transfer the phone call directly to that county. You may end up in an answering machine, you may end up with a voicemail, you may end up with a live answer, but call that number. And if the county doesn't have Sheba services, the staff in Salem will answer that question.
So tell us a couple new developments in Part D plans this year, Bob, if you could quickly.
The major change this year is that they've gone to a 6-tier drug pricing schedule. Be sure and check that out. But more importantly, we've had a lot of advertisement about the insulin savings. And if you look on the Medicare Plan Finder, there on the upper right-hand corner under the filters, there's an insulin savings program. And if you enter all of your medications and click on that, and one of them happens to be insulin, 3 Medicare Advantage plans, companies actually have or participate in that program, and 9 standalone drug plans participate in that program. So not every company participates, and not all insulin is covered, but it's something, it's a step forward, and it could reduce your cost to $35 for insulin. I went a little bit further at a friend's request and looked at it, and the $35 seemed to hold whether it was 1 vial or 2 or 3. So that's a pretty substantial savings. But again, not all plans participate and not all insulins are covered. So be sure to look at it real careful. And that's something where Sheba volunteers could come in and help. A salesperson can also help in that same quest.
All right. Yeah, actually, we got a question here from a reader who wants to arrange a one-on-one session with you, Bob. We'll have to deal with that later, I think.
Okay.
You're pressing somebody. One other question from a viewer, and anybody else can answer this too. In previous years, it was suggested that it might be advantageous for people, and I just lost it, people to switch. Hold on. Oh, sorry. The question disappeared off my screen, and it was an involved one. I apologize.
Brent,
it had to do with switching from Plan F to Plan G in Medigap.
Okay. That would probably be something you'd want to be working with an agent to do, but also Oregon is one of 2 states nationwide that has the Medigap birthday rule. If you're currently in Medigap, on your birthday and 30 days after, you can switch to another company. So every year around your birthday, you could be looking at possibly getting a lower premium for the exact same coverage. You can also switch to less coverage, but once you do that, you'd be subject to underwriting to go back up to a higher level of coverage. But the birthday rule has just been well received, and it's been pretty incredible that we have it here in Oregon. California is the other state that has it.
Now, here's a question. Lisa, you might want to jump in and answer this. My questions keep disappearing. If my birthday is midway through the month, do I sign on for Medicare at the start of the month or at the next month, at the start of the following month? Did you hear me, Lisa?
Sorry about that. So the reason that the question disappeared on you, Brent, was actually my fault. I was answering it untyped, but to answer it for the audience, when you enroll in Medicare, generally speaking, especially Medicare Part B, it's going to be effective on the first day of the month of your 65th birthday, or you can obviously change that if you're going to stay with employer coverage. The only time it differs on your initial enrollment is if your birthday actually fell on the first day of the month. So let's say your birthday was October 1st, then your Medicare eligibility, your original eligibility would actually be September 1st. Short of that, it's always the first day of the month of your birthday month.
Got it.
And the other question that you had, Brent, was about moving from a Plan F to a Plan G, and if that makes sense because of the cost. So I did answer that one also, but really, the big thing to ask if you're going to make that change is to make sure that whatever premium savings you may get from moving from a Medigap Plan F to a Plan G is at least larger than the current Medicare Part B deductible, which is what you would take on in a gap exposure going from a Plan F to a Plan G.
Got it. Great. Well, we covered most of the questions. So, and it's been a great panel, I think. Thanks so much, everybody for joining us. This has been recorded. Every attendee will get the recording emailed to you so you can review it. I know there's a lot of information. There's a lot to cover. There's a lot we didn't cover. We'll also try to answer some individual questions that we didn't answer during the presentation. We'll try to answer by email. You can also email me directly at OregonianMedicare@gmail.com, and we'll do our best to answer your specific questions. So Lisa, Jason, and Bob, thank you very much. And thanks also to our sponsor, Regents. I hope everybody feels a little bit better about preparing for their Medicare journey. Everybody have a great afternoon, and we'll see you again soon.